What's going on YouTube? It's Dan, it's Ken. It's Dan and Ken PT. And today, we're going to talk about jumper's knee, or patellar tendinitis. A quick review for today. So, we're going to talk about some anatomy of the knee and the patellar tendon, some causes and symptoms, and some exercises that you could do to help with your symptoms and prevent this from happening in the future.
Okay, so in this picture you have a view of the knee from the front. So you can see the patella there, that's your kneecap, and right below the kneecap is the patellar tendon. That's the structure that is affected in patellar tendinitis or jumper's knee. So it attaches your kneecap to the front of your tibia, the bone right below. So now that you get a good view of what's going on, we're going to go and talk about what causes patellar tendinitis.
So let's first talk about some causes of patellar tendinitis or jumper's knee. Well, it's called jumper's knee for a reason. It's very common in runners, basketball players, people that jump.
And another cause of patellar tendinitis is just jumping into an activity without proper training. So for example, someone that has never run 2 miles in their whole life decides to go for a 2-mile run without proper training or proper progression. So they probably should have started maybe a half-mile run first, progressed a mile, 1.5, then hit that 2-mile run.
Yep. They went from 0 to 100 without going to 50. They didn't progress. Any other causes? We talked about running, basketball, jumping, and it's not so much these activities that are causing it, it's improper maintenance of the strengthening of your quad and your hips. Like Dan was saying, you don't want to just jump into these activities, or even if you have been doing them for a while, you want to make sure you're strengthening the surrounding structures, which we'll talk about now. But first, some symptoms. Dan, what have you noticed about symptoms of patellar tendinitis?
Commonly you can get a sharp pain right in front of the knee, right below your kneecap, some swelling and tenderness to touch, pain going up and down stairs, squatting.
Stairs, big one, that's good.
You might have pain during and after activity, sometimes at rest. I've heard people just sitting down with their knee bent, they'll feel their knees start to ache right in the front.
They usually find some relief when it's kind of straightened out and relaxed.
Yeah.
Okay guys, we're going to talk about a few exercises to help with your symptoms and prevent future knee pain.
Okay, I'm going to show you the wall slide or the wall squat. So find a wall or door, something slick that you can lean on, that you can slide against. So my back's against the doorway, I'm going to walk my feet forward a little bit, my weight's through my heels, I'm going to slowly slide down against this doorway, and then stop before I feel any pain. So you're doing this in a pain-free range of motion. You're going to slide all the way back up. So as you do this, you're working your quad muscles here, the front of your thighs. So as you're doing this, you're going to feel a burn in this muscle group here. That's how you know you're working the right muscle group. Nice and slow. Watch where your knees are. Keep them aligned. You don't want your knees going too far forward like this, and then my back's already off the wall. You want to maintain your back against the wall. Keep your knee in alignment that they're not going in, they're not going too far out, they're not going too far forward either. So repetition doesn't matter, consistency does. Okay, this next one is called the side lying clam. So how you want to get set up here is you're going to lay on your side. I'm propped up on my elbow right now, but if you feel more comfortable, doing this in bed, on the couch, you can lay down, set up a pillow like you're just laying on your side. So you want your knees and feet together to start, knees bent and up forward a little bit. So the muscle that we're working to strengthen here is your glute medius right here. So you're going to feel it right on the side of your hip. So keeping your feet together, you're going to lift this top knee up and then bring it back down. Maintain the hip in neutral here, so you don't want it rolling back. That's what a lot of people tend to do, and you're not going to work your glute med that way if you're rolling back. So maybe if you are feeling your hip is rolling back, you can do this against the wall, up against something to keep that hip from rolling back. So when you're doing this, you're gonna feel the burn right up here on the side of your hip. That's the glute med we're working. Again, repetition doesn't matter, but consistency does.
Let's talk about one more exercise that you could do. So in Dutton's orthopedic book, he talks about the importance of strengthening your anterior tibialis muscle to help with patellar tendinitis. That's your muscle here. This is called your anterior tibialis muscle. It does dorsiflexion. It does this. So what you could do to strengthen that muscle, stand at a wall. Make sure you know where the wall is with your hands. Stand tall. Keep everything straight. Fall back. And try to catch yourself. Now, worst comes to worst, you just use your hands and catch yourself. So if you go too far, try to catch yourself and just grab on. Now what that does is it strengthens that anterior tibialis muscle. Go back and slowly fall back. If you can, try to come back without touching the wall. It's kind of hard. Whoa. Now, consistency is important here. A good place to start is Monday, Wednesday, Friday, 20 reps. Guys, a quick review of today. We went over some anatomy of the knee, some causes and symptoms of patellar tendinitis, or jumper's knee, and some exercises you could do to help alleviate your symptoms and prevent future knee pain. We hope you liked the video. If you did, give a big thumbs up and subscribe down below. If you have questions or suggestions for future videos, please email us at danandkenpt@gmail.com. And remember, live, laugh,
Love.